Philadelphia health officials try to keep up with increasing monkeypox cases. Concern is now setting in after the city's vaccine allotment was significantly reduced.
In an effort to conserve the vaccine, the FDA reduced Philly's number of vials from 3,612 to just 720. So Philadelphia's health commissioner, Dr. Bettigole, joins us now that we have this new information. Good morning. Thank you for joining us.
Good morning.
Sure. Good morning. It's a pleasure to be here.
So what kind of position does this put the Philadelphia Health Department in? Because we know that cases are going up every week, to know that it's been cut so drastically to just 720 vaccines for monkeypox.
Yeah, so just to clarify a little bit, what happened was that with this new dose conserving strategy that the FDA announced, we had understood that we were going to have the ability to vaccinate far more people. And so that's what we've been telling people. What they're actually doing is, instead of giving us the 3,600 vials, which would have translated into up to 5 doses per vial, we're now only getting 720 vials. So in terms of actual doses, instead of getting a huge increase, we're way, or at least somewhat below where we were before. That up to 5 doses per vial means, if we're lucky, we can get 5 doses from most vials, but there'll certainly be some times where we're not able to get all of those doses from a single vial. So instead of looking at, can we expand, can we start really doing prevention on this and reaching people who are high risk but don't have a known exposure, we're back where we were, having to strictly ration the vaccine.
So just to clarify, because that's a big difference from 3,600 down to 720, are the vials going to different cities, or what was the reason given to the health department?
Yeah, our understanding is not that they're being sent somewhere else, but that they're being conserved and that we'll get them at some future date. We haven't gotten a date for that, but they're now talking about a wave 4. Initially, we heard September, and now we're hearing hopefully sometime soon, but don't have a date again, that we will get additional vaccine. But it's difficult to plan, because if we use up the vaccine we have doing that preventive strategy we're hoping for and don't have vaccine to give people with a known exposure, that's not going to work.
Right. It's like we're being reactive here instead of proactive when it comes to this. So when it comes to conserving doses, then, for folks who are concerned, who wanted to get that vaccine, what does that mean? Will it be as effective, or it's just enough to get them by? What is the difference in between getting, before this, when they weren't conserving the full vial, versus 5 people sharing it?
So the dose conserving strategy is a smaller dose, as you're saying, but it's injected into the layers of the skin instead of subcutaneously or through the skin. And that's a strategy that the World Health Organization and other public health authorities have recommended for emergencies where you need to stretch vaccine. There are immune cells in the skin that can make vaccine administered that way more effective, so you're able to stretch your vaccine. So that piece of it makes sense. It does require some additional training to make sure all vaccinators can do an intradermal or into the skin vaccine. It's similar to what you would have had if you had a TB test as a child, where you get a shot into the skin, usually of the forearm. It raises a little bubble that goes down over the next few hours. So, it's a technique we use, but not as widely. So a little bit of additional work to do it, but we do think that it will be an effective way to give this vaccine.
So 2 parts here. What does that mean as far as the wait time now with the reduction in doses? And for those who don't understand, what exactly is the vaccine preventing?
So what we're trying to do is to prevent the symptoms of monkeypox. Monkeypox, in Africa, there have certainly been fatalities. There have been a handful of fatalities in Europe. We fortunately have not seen anyone die from monkeypox in the U.S., despite having now more than 11,000 cases. But it causes a very painful rash that can last for up to 4 weeks, and in some cases can scar. So we're trying to prevent that, and especially the more serious outcomes. You can give monkeypox vaccine after an exposure. If you give it quickly, within the few days after someone's been exposed, we can prevent them from getting sick. But it's more effective if we could reach people who are at high risk of exposure before they get exposed and get them vaccinated so they're protected. And that's the piece that we had hoped to move to starting as soon as this week that we're not able to do yet.
So you're prioritizing individuals on high risk. How long are the wait times? Typically, how long are they waiting to get that vaccine?
Well, there are people who've been waiting for weeks to get this. So we're again, trying to go with that highest risk. So if somebody has a known exposure, we're going to try to get them vaccinated within a few days. But for anybody who knows they're high risk, they're falling into those high risk groups who have a likelihood of exposure, they may be waiting for weeks for vaccine.
And then really quickly, because we just heard the news out of Paris where a dog has contracted monkeypox. What does this mean for folks here who may be concerned when it comes to their pets?
So not a lot. What it means for everybody really is this is something that is contagious largely through skin-to-skin transmission. So hugging, kissing, cuddling, and sexual contact. People obviously are not having sex with their pets, but they do cuddle them. And so anybody with a rash, it's a good idea to cover that rash. I mean, you also want to get medical attention for that rash and make sure you know what it is. There are lots of things that could be that might need treatment. But for anyone who does have monkeypox, keeping that rash covered will help protect your pet. We haven't seen cases in dogs in the U.S. It's not impossible. If somebody lives with a dog and they have monkeypox, skin-to-skin transmission when they pet their dog or snuggle their dog could happen. So, it's just about being careful to keep that rash covered to protect the pet.
You want to stay aware. I know it's all about education as we wait for more vaccines to become available.
Exactly.
I know it's been a hard balance, but certainly do appreciate your time, Dr. Bettigole.
Sure. Thanks so much.
Yes.